For our pathogen, we chose rabies. This is by Taylor Fernandez, Andrea Fernandez, and Alexa Flores. What is rabies? Rabies is a fatal but preventable viral disease. It is spread to people and animals through bites or scratches from the infected. The virus primarily affects the central nervous system, leading to severe brain disease and death if no medical care is received. It is rare in people in the United States, with less than 10 deaths reported each year. A closer look. For the structure, it is a rod or bullet-shaped, single-stranded, negative-sense, unsegmented, enveloped RNA virus. It measures approximately 60 nanometers by 180 nanometers. It is composed of internal protein core or neocapsid containing the nucleic acid and an outer envelope, a lipid-containing bilayer covered with transmembrane glycoprotein spikes. For historical background, rabies has been known to mankind for at least 4,000 years. Man has lived beside animal for as long as we've known. Cuneiform tablets have been found dating back to 1770 BCE with mentions of rabid animals and their consequences. There has been text found by clinicians, veterinarians, surgeons, pharmacists, but also writers, philosophers, and poets, all regarding rabies in history. I included a little picture that just shows the punishment if you had an animal that had rabies and someone else contracted it. The life cycle of rabies. So it starts with the infected animal, the replication of the virus in the muscles at the site of the bite. The virus moves to the CNS. After reaching the brain, the virus starts replicating. Brain dysfunction and symptoms occur due to protein defects and the manipulation of behavior by viral action in the amygdala and hippocampus. The virus further moves out of the CNS into other body organs like the salivary glands. Salivary glands secrete excess saliva by hypersalivation and are maintained by hydrophobia through the neurological manipulation for an optical chance at transmission. Portal of entry. There are three primary portals of entry. Bite wounds. Infected saliva enters directly through the skin, muscle, or nerves. Mucous membranes. Virus seeps into the membranes of the other's eyes, nose, or mouth. Open wounds from a scratch or other lesion. Contaminated saliva can enter the host. The route of transmission. Rabies is highly contagious and is spread through saliva of an infected animal. The source is predominantly dogs in the US, but other common sources are wild animals, including bats, raccoons, skunks, or foxes. The transmission is typically a bite or scratch where the infected saliva enters the body. The virus replicates rapidly in the muscle tissue, then attaches to the nerves and travels directly to the brain and infects the central nervous system. Rabies then travels to the salivary glands of the new host, causing them to be extremely contagious. Pathogenesis. The central nervous system is the main system that is affected by rabies, which includes the brain and spinal cord. This causes fatal inflammation known as encephalitis. After the CNS is targeted, the PNS and ANS are affected, along with the salivary glands, musculoskeletal system, cardiovascular system, and respiratory system. Epidemiology. Rabies is estimated to cause 59,000 human deaths annually over 150 countries, with 95% of cases occurring in Africa and Asia. This is a worldwide burden with cases all over, although the true number cannot be exact due to underreporting. According to the WHO, human rabies is present in 150 countries and on all continents, excluding Antarctica.
Now we move on and look at the morbidity and mortality rates. Nearly 60,000 casualties around the world, about 10 casualties in the United States alone, and about 45 people are infected between California, North Dakota, and Minnesota. And I provided an image of a raccoon because that's usually one of the animals that we encounter, and then we think about rabies in general. Then we look at the prevalence and the incidence rates. Asia and Africa are the countries that are most affected by rabies. 95% of cases occur in Asia. Foxes have the highest percentage, which is 78.3%. Asia has 52% prevalence in humans and 23% prevalence in animals. Now we look at the clinical presentation. Some of the symptoms include fever, insomnia, headache, vomiting, confusion, difficulty swallowing. You can walk. Partial paralysis, hallucinations, and excessive salivation. Some signs include seek immediate medical attention if bitten by any animal. Rabies can be deadly if not treated, and also signs can mimic those of the flu, which can be kind of difficult to identify if you are in the US. Some treatment methods. Fast acting shots are needed and to treat rabies. You need to get at least 4 shots in the span of 14 days for rabies. 2 injections in the first 3 days for it to work rapidly. A series of shots will help the body identify the virus and will help fight it. This can also lead to death if left untreated.
The antimicrobials of the rabies virus are rabies immune globulin, monoclonal antibodies, and clofazimine. For the mechanism of action for rabies immune globulin, this drug first enters the wound, and the highest concentration of antibodies is the most concentrated. The immunoglobulin G molecules then stick to the rabies virus's glycoprotein, and this action blocks the virus from getting into the nerve cells at the wound while forming a antibody shield. For the monoclonal antibodies, these lab-produced antibodies latch onto the rabies virus's glycoprotein, and through this action, these antibodies lock the glycoprotein in the pre-fusion conformation, which also prevents the virus from spreading further into the body. And then clofazimine. Similarly to the other two, clofazimine molecules also bind to the glycoprotein, and the virus ends up getting locked into place, unable to infect more healthy cells. The three treatment modalities of the rabies virus are pre-exposure prophylaxis, post-exposure prophylaxis, and management of clinical rabies. Pre-exposure prophylaxis is pretty much 2 vaccines that are administered to a person to protect them from getting rabies. First, the pre-exposure vaccine is administered, and then two doses of the cell culture anti-rabies vaccine is also given. This intervention is successful as it stimulates the immune system's response to produce antibodies to also protect against this virus. Post-exposure prophylaxis includes wound care, human rabies, immunoglobulin, and the rabies vaccine, which are given to the patient to prevent death. Wound care is simply cleaning the wound up to decrease risks of infection, while the human rabies immunoglobulin also provides the patient with antibodies. Finally, the rabies vaccine is also given to the patient regardless of exposure or not. Then the management of clinical rabies is more simple and includes giving the patient the prophylaxis and the rabies vaccines while also monitoring the patient in the hospital, giving them at least a little bit more time. Lastly, preventive measures. These are very simple. Both people and pets must stay away from wildlife, even if they appear unwell or dead, along with pet owners also keeping their pets up to date with rabies vaccines.
And I've included the references. So these are the main references that I used on my slides. And the references continued. These are Alexa's references. And lastly, these are Andrea's references.